Okay. All right. So thanks again to Spring for being willing to pinch hit like that. And in a way, I think it was really good to have her talk through really laying a good foundation around one, a program, as well as some of the issues that come up around social emotional learning. I was asked to really talk about some issues related to collaboration. And I can just make sure uh, do I have the control? There we go. It really, for me, my conversation is going to come from, I'm going to date this back to around 2007. I was moving between systems, and I think that's going to be my focus. I have sort of lived between different large systems. From school social work here in Illinois, we have a very large school social work association, which I'm clear is not the case in many of our states. And I was actually preparing to teach a group of school social work students. And one of the topics, of course, was social emotional learning. And in another area of my life, I was also working, as I do currently, around child welfare and supporting trauma-informed care for populations of children who have been exposed to early adversity and trauma. And so it really became clear to me in preparing students to think about those issues that there is a common nexus, perhaps, that we could capitalize on if we knew what each other were doing. And so that's really going to be my focus in this conversation for this brief time. All right, so we know in social and emotional learning, and particularly when we're talking just our normal development, we hear folks in pre-K, folks in kindergarten, and hopefully parents at home telling us to learn to use our words. Some of us know adults who are still struggling around those areas. Clearly, as we get greater command for social emotional development, it improves our relationships with others. It supports our academic achievement, our general mental health and well-being. Those things, sorry, this seems to be a duplicate. And I'm still having a bit of trouble with there we go. We learn these skills in our best parenting relationships through feedback that we get from our parents. Hopefully we're experiencing we call good enough parenting, consistency, parents tuning into feelings like you're frustrated, you seem to be angry right now, and really helping us to support learning to manage both positive and negative emotions. There are some possibilities that if we could connect the good work that we're seeing, especially in pre-K environments. Now, I wish we were seeing it more throughout the whole educational continuum, that we would continue to support this both in the home and in school settings. But this can be a particular challenge where there's trauma involved for families and for children. We know that trauma kind of gets us off track, as that train analogy just showed us as it relates to child development. And the particular form I want to focus in on for just a moment is where there is certain kinds of issues in families that we would equate with what we call complex trauma. That's where there are relationship challenges between child and family brought on by, struggling around those really big issues that we see a lot, both in child welfare and mental health, substance abuse, parental mental illness, and interpersonal family violence. And I know Spring was just talking about engaging families in general, and we sometimes see a particular challenge of engaging families to support the work in these particular areas. When these families, though, do come to the attention of clinicians to work with us around trauma-informed practices, we try to support some of the ways that they have been adversely affected. In families who are, focused around things like substance abuse issues, for example, trauma issues, community violence issues, the child is in fact doing what all children do and sending us some signals in that they need a particular thing from that parent, but that signal is not being received. And so they then begin to shut down, not demonstrate to their families what some of their needs are, and in many cases we see behavioral acting out. And that gets our attention, clearly. So usually one of the first things we try and do, both in treatment settings and in school settings is to learn what, affect identification is. What is it that we are experiencing and feeling. But one of the things that we find is that for families where there has been involvement around trauma, is that those children are, because they're so often used to threats that they're experiencing in their family environment, in their home environment, they become what we call very hypervigilant. So they're constantly watching for things that might be going on out in their world and less attuned to feelings that they're experiencing. And so they have particular challenges with telling you, being in touch, first of all, with what they feel, with being able to predict how they're going to respond, how their feelings may change very quickly. So their ongoing experiences of threat and lack of safety then challenges their ability to read others and to read their own emotional cues. So tying together, social emotional competencies are working in this area, promoting self-awareness, managing our emotions and our behaviors, managing relationships and decision-making. But is it possible that sometimes, and I know this is true both for educators, for child welfare professionals, for a lot of different settings, where we start focusing so much on behavior that we miss that really underneath there are signals that a child is sending to us saying, I'm really scared. And because I got scared, I got deregulated, is what we would call it sometimes. And so we start really zeroing in on fixing the behavior rather than really dealing with those underlying things. I think we think a lot more about this for our little kids too than when we see these bigger behaviors as kids get a lot older. My hypothesis, others may disagree. I'd love to talk to you about that. Now, when we think about trauma treatment, our first thing we have to promote is safety. And I'm not just talking about physical safety like we sometimes think about in child welfare, maybe removing a child from an environment that poses some risk to them. I'm talking about psychological safety. And that's a much harder thing for us to think about because simply when my computer went down a minute ago, I did not feel psychologically safe and my stress level went up dramatically. Fortunately, I did not become completely deregulated and we got it back online. Little stressors through our day at school, out in the neighborhood, in the house, really can create some threats to safety. So even sometimes when it looks like kids have gotten skills, they've been able to demonstrate them sometimes, those threats then sometimes leave them unable to use skills that they have in fact begun to develop. So we then move very quickly from establishing the sense of feeling psychologically safe, that this is an okay place to express emotion, to developing emotional regulation skills. And clinicians are working with this who are doing trauma treatment with little ones, and we do trauma treatment with babies even between the ages of birth through 3 in the project that I'm working with, and some of you know projects like that. So we start to begin to have parents better tune into what babies are experiencing, but we do it all the way through all ages. That establishing safety and then thinking about emotional regulation are skills that trauma clinicians are often working on. So safety has to be there first, and safety is often something that someone is experiencing subjectively or internally. And so sometimes I've seen files, and when I've done reviews in schools, where people have said, this just happened. This, horrific behavior just happened. There really was nothing before it. And really what happened is that something inside happened for that little one or that older child as well that really triggered that behavior. And those are hard things for us to do some detective work about. So sometimes we see these behaviors that we think are really out of proportion for, I just asked him to give me paper and something really bad happened. I know some of us have seen those things. So really what my goal is in this little brief time is to think about how can we potentially get on the same page when we think about both trauma-informed care and how that's happening both in schools and communities and homes. Because if a child was experiencing in an ideal world that I would like to create, both support at home where they're doing work around things like things Spring was talking about, and parent education and parent support in classes, but they also are working in cooperation with trauma-informed providers in the community so that we're seeing the home, the school, and that clinician all working together in a coordinated way, that would be an ideal way to really take that child, making them feel safe across environments and having skills then reinforced across different environments. So what would that take? It would take us talking to one another. And when I've talked about this at various conference settings here locally, first of all, most clinicians would tell me, I've done this at school-based conferences, I've done this at clinical conferences, and people have said they really are not necessarily aware of each other's roles or that these possibilities even exist, which I think is a big step one. Often though, what they also tell me, and this may be changing because I'm not as focused in the school area at the present time, and I'm seeing great new opportunities that have been emerging, but it is possible that we're not seeing the SEL being reinforced at all ages and stages. So thanks, Cor, for the time. I got it. So our goal then is to really bring everybody together to support CUES in the same way. And that collaboration would be really important to think about for these children that we're talking about. We're going to have to do some modifications in light of their unique experiences. It's really good to see the progress that we're making in the field of social emotional development. When I was first teaching my students about this, things like pyramid did not exist. That really looked at modifying the universal approaches that we started with SEL for special populations. And so that I'm really encouraged by, to really start to promote those cross-system conversations in more targeted ways. But I do think that that's something that we're going to have to do sometimes at very local levels when we specifically as teachers or as clinicians are involved in cases. And just my last point to make is that doing any of this kind of work around trauma practices and working around these tough cases can be very, very difficult. And so I'm obviously promoting a discussion here around teamwork, leadership sometimes, and that just sometimes means that true believer leading an effort to coordinate, get releases, talk to one another. But then at the bottom there, because I do work for an office called Wellbeing, I had to throw in some things that we need to do to take care of ourselves, achieving a work-life balance and taking good care of ourselves, especially on stressful days like today.